From the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. Thank you for joining us for Medical Mondays. I'm Carrie Sharp, and today's topic is going to be a fun one. We are talking about babies, planning for babies, having babies, and everything that comes in between. So if you have a question about pregnancy, about delivery, about getting pregnant, or why you can't get pregnant, tonight is the night to call. We have a lovely doctor here with us tonight, Dr. Kristen Walko. Thank you so much for being with us. Nice to meet you. You have kind of a newer addition to Women's Medical Associates of Nashville, so welcome on board to them. Tell us about how you got interested in obstetrics and gynecology.
So in medical school, I knew that I liked surgery, and you can either go toward surgery or you can go toward a mix of surgery and, continuity of patient care. And I really liked having a relationship with my patients. I liked that kind of lifelong care and relationship that you have with them. So that's really what drew me toward being an OBGYN. I meet the patients, I take care of them through their pregnancies, deliver their babies, and then later on in life I take care of them as they may need surgery and as they get older, and I really liked that.
And I think that all women know who have been to an OB, you have a special kind of relationship with that doctor that you don't have with any other doctor, because often you're talking about emotional, very private issues, and so you do have a bond and you want that special relationship. Don't you think so? You're a mom.
Yes,
you're
exactly.
a woman, you know this.
Yes, exactly. I mean, when I was choosing my own OBGYN, of course I chose somebody who not only was, my colleague, but my friend and a trusted advisor as well. So I can really appreciate, when patients are choosing an OBGYN.
So I mentioned tonight's topic is all about babies. Whether you're planning a pregnancy or you're just pregnant or you're rounding out your pregnancy, you want to get pregnant, you can't get pregnant. If you have questions, tonight is the night to call. Not only do you get free advice, but maybe advice that can help you along your journey in this. So go ahead and give us a call. We'll get those lined up. 615-737-PLUS is the number to call. 615-737-PLUS. Our producer will get those lined up, and as soon as we get them, we'll start taking them. So again, this is your night to call in, but I'm going to ask the questions for now. So if someone is planning a pregnancy, if a patient has been seeing you for a while and they say, you know what, I'm thinking about getting pregnant, maybe in the next year, we're going to start trying, what's the advice that you give them at that point?
So when a patient, says, I'm planning on getting pregnant in the next 6 months to a year, my husband and I have been talking about it, I tell them first and foremost, you want to this is going to be a marathon, something that your body has never gone through before. Okay, so you want to really prep for that. You want to be at your healthiest. You want to, start paying attention to your diet, paying attention to your exercise, and, kind of just preparing your body for, one of the hardest things it's ever going to do. Yeah,
without a doubt, and it's a 10-month duration once you do conceive. So it really has to be, you do, if you can, it's nice to prepare. Nutrition-wise, what should people be thinking about and doing?
So nutrition-wise, nothing, prior to pregnancy, nothing really different. Okay, I tell patients, fad diets, I definitely recommend against. Okay, so there's no specific diet plan that is going to be your miracle. Okay, so a healthy, balanced diet. Now, if a patient has, certain diet restrictions, if they're vegetarian, I'll talk to them about, different supplements that they may need during the pregnancy, making sure that they get enough iron because they're not eating the red meat, obviously, so making sure that they get their greens, and they can always, start a prenatal vitamin, before you get pregnant. That's why it's called a prenatal vitamin.
Right.
So,
and a lot of that includes folic acid, which is so very important and really important before you do get pregnant. Explain why.
So folic acid is necessary to prevent neural tube defects in the baby. Okay, so a neural tube defect is essentially spina bifida. Okay, and it's basically an opening in the baby's spinal column. Okay, so there's different variations in the severity of that, but that's very easily prevented, especially in America, where we have lots of resources and lots of our food is supplemented with folic acid. So I tell patients, take that prenatal vitamin. That'll give you pretty much everything that you need as far as the folic acid is concerned, in addition to all of the foods that they normally eat.
If someone is working on getting pregnant, do they need to stop drinking just in case? Do they need to stop smoking just in case? What do you tell them?
So I get this question a lot. Smoking, certainly. Okay, so smoking, any patient, whether they're planning on getting pregnant, whether they're planning on never getting pregnant, I counsel all my patients to stop smoking. Okay, e-cigarettes, that's not stopping smoking. Okay, so no cigarettes, no chewing tobacco, obviously, no e-cigarettes. And the sooner the better. There's really no...
It's only going to benefit you. Yeah.
Right. And cigarette smoking during pregnancy, we know that it's extremely harmful not only to the mother but also to the baby.
Yeah.
So you can have low birth weight. It can contribute to other complications in pregnancy, and it's easily prevented. I know it's difficult to stop, but it's certainly necessary. Alcohol, while you're getting pregnant, or while you're trying to get pregnant, that's kind of the gray area, because there is about a 5-week time span where you could be pregnant and you don't know it.
Yeah.
So I tell patients, you don't necessarily have to go cold turkey. If you have, a half a glass of wine here and there during that kind of gray area where you're trying to get pregnant, usually no harm. Okay. As soon as you find out you're pregnant, obviously no alcohol for the next 10 months. And then if you're breastfeeding, longer.
Yeah. Yeah. Keep that alcohol in the cabinet. There will be a time later on. I see we do have a call, so we'll get the name there in just a second. But let's talk about once folks do get pregnant and that alcohol question, because I'm sure you've had patients that come in and say, oh my goodness, I'm pregnant, I didn't know, I've had a few. Do people need to be worried? What are the risks?
So I get that question from pretty much every pregnant patient that comes into my office. They're like, I had some drinks, I didn't know I was pregnant.
Yeah.
Usually at that point, when I see patients, they're 8 or 9 weeks pregnant. If nothing has come of the pregnancy at that point in time, if no harm, a miscarriage, etc., it's an all or nothing at that point. So if nothing has happened, then everything's fine.
Good to
essentially
know. I'm sure that's a sigh of relief for a lot of people at that point.
Yes.
All right, I always promise when we get calls, we'll jump right to the line. Marilyn is on the line. Marilyn, thank you for being with us tonight. What's your question?
Hi, I was wondering if I've been on birth control for like 15 years, now I'm in my 30s, approaching my mid-30s, and I want to start planning for a family. How long do I need to, when do I need to go to my doctor and say, do I need fertility treatments? When should I get off my birth control? When do I go about doing that? Should I just go now? I am 33, so...
That's an excellent question, Marilyn, and thank you so much for calling in. So I actually have a lot of patients like this, and I tell patients, once you are planning to get pregnant, you stop your birth control. If you are under the age of 35, I usually recommend trying to get pregnant with your husband or your partner for 12 months. Okay, if you haven't conceived at that point, then come to the doctor. Now 12 months is a really long time.
Sure.
Okay, and patients, especially when they're 33 and they've been waiting and planning for this for a really long time, they usually can't wait that long. So in reality, it's 6 months. Okay, so the official recommendation, 12 months, but usually it's 6 months.
People show up on your doorstep saying, it's not happening.
Exactly. Yeah. Now, if you're over the age of 35, fertility decreases as you age, and I always recommend patients come in and have a conversation with their OBGYN. Good. But certainly before 6 months.
Yeah. Okay, Marilyn, good luck to you. Hopefully you've got baby news here in the future. I do have a question about the age thing. I had both my babies, both my little boys, after 35. So, is it the age or is it your physical well-being that really makes a difference? Because someone can be 35 and look one way and feel one way and be in a physical, capability, and then you have another 35-year-old that's completely different. What is it?
Yeah, so unfortunately it's a lot of different factors, and you can be the healthiest, most fit 35-year-old there ever was, and you still have a decreased egg supply. A lot of that can be genetics, and you know, we don't know. There's so much that goes into it. We really don't have all the answers for that. But, you know, I would not, you can ask, you know, your family history. You can ask your mother, ask your grandmothers, you know, how old were they when they had their pregnancies, if they had any problems, if they had a lot of miscarriages. And that's one way to start. But I tell patients, it doesn't matter how, you know, how healthy that you try to be, you can't really control how many eggs you have. So I certainly wouldn't, you know, bank on that, and you know, have that conversation with your OBGYN earlier, while there's still, you know, something that you can do about it.
Absolutely. Okay, some great information already. If you have a call, now is the time to do it. 615-737+. We're going to take a quick break, and we're coming right back talking babies tonight. Stay with us.